Hello, I'm Jeremy Fernandez. Welcome to The Virus, our Sunday night look back on the key turning points of the week in this crisis and what you can expect as the government plots our way out of this shutdown. The wind back is already happening in other parts of the world, so what clues do countries such as Germany give us on how Australia can get back to normal? That's coming up. But first, here are the figures as they stand. Although the number of deaths has increased, overall new cases of infection are falling. We've had fewer than 50 infections detected each day over the past week, and that means the number of new cases is trending downwards. So much so, the Chief Medical Officer is confident Australia has passed the peak of the coronavirus pandemic.
We're on the same trajectory as New Zealand, which is aiming for eradication, and if we achieve complete lack of transmission and no cases, that would be great. But we don't know then whether there are asymptomatic cases circulating. You cannot relax your surveillance and control mechanisms.
So this is why Australia, like New Zealand, is looking at addressing the growing social unease at the isolation measures. Our cumulative total is plateauing at a level significantly below the global hotspots. The way out will be incremental, and this week Australian authorities outlined a roadmap towards the easing of restrictions. To get there are three criteria that need to be met: broadening the testing regime, getting better at identifying the causes of infection clusters, and setting up a better way to contain those outbreaks. The Prime Minister, Scott Morrison, says those measures need to be in place within 4 weeks.
This is what happens if you don't. If we don't get those three things in place, because I've heard this theory, I'll just go and let it go now, and if it gets worse, we'll do it all again. Well, I'll tell you what happens then. The outbreak gets so severe, and if you want to know what it looks like, go and look at New York, go and look at London, go and look at Spain, all of those places. That could be Australia.
Meanwhile, the US government has also outlined a three-stage plan to guide its states towards reopening. The President Donald Trump says the improvement in some areas has been so positive they could start getting back to normal in as little as 6 weeks. But first, authorities want to see a 2-week decline in COVID-like cases and the introduction of a more rigorous testing regime. The situation in the US is far more grim than it is here. They have more than 730,000 cases and more than 39,000 deaths. Mr. Trump is confident the death rate will peak soon.
And I think we'll be substantially, hopefully, below the 100 number. And I think right now we're heading at probably around 60, maybe 65,000.
Some European countries have gone even further this week, setting specific dates to reopen public spaces and to relax isolation measures. And that gives us a picture of what Australian policymakers may do in 4 weeks to wind back the restrictions here. Germany is one of those nations mapping out its comeback from coronavirus. The EU's biggest powerhouse has been able to sidestep the high death tolls of its southern counterparts through strict border and social controls. Even so, it's recorded more than 139,000 infections and well over 4,000 deaths. Early in the outbreak, German health authorities identified an abundance of intensive care beds, 28,000 of them, plus 25,000 ventilators, and they quickly ordered 10,000 more. It's also trying to keep its economic credentials intact, approving nearly $1.3 trillion in stimulus spending. And now Germany's looking to get back to business.
This isn't a race. However, we have to understand we'll be living with this virus until we have the medication or a vaccine to deal with it.
And this is how they're doing it. First, primary schools will open early next month, with students in their last year of primary and secondary schooling getting priority. Kids in early primary and kindergarten will wait a little longer. Retailers occupying less than 800 square metres will be allowed to reopen next week. Bars, restaurants, theatres and cinemas will stay closed until further notice. Religious gatherings will also remain suspended. The strict controls on Germany's borders will remain for at least another 3 weeks. Then, large events such as sporting matches and concerts will be allowed from the end of August. Easing restrictions is a luxury countries such as Spain and Italy can't afford right now, and the EU has issued a stern warning that countries that act on their own could inadvertently bring on a second wave of infections.
First a city, then a country, then the world. With reports of deaths on most continents and no vaccine in sight, the questions remain. How far will the virus spread? How many lives will it take?
Well, among the signs of hope we've been seeing, this week has brought us another reminder of why this virus is so troubling. There are now more than 2.3 million cases of infection and more than 160,000 deaths worldwide. China increased its death toll significantly, adding another 1,300 deaths from the city of Wuhan. The revision followed widespread speculation that China's death toll had been significantly higher than it had initially reported. Much of the world is still in the middle of this crisis, and that's why there's been widespread condemnation of the US decision to cut its funding to the World Health Organization. President Trump has repeatedly criticised how the UN body has handled this pandemic, accusing it of mismanagement and covering up data. He also says the WHO is unduly influenced by China, which the American government says covered up the origins of COVID-19. If the cut is enacted, it would force the WHO into bankruptcy.
When we're divided, the virus exploits the cracks between us.
What was the point in Tedros to say, yes, you're cooperating now, but we heard you concealed before, so shame on you, shame on you. What would we have gained? I think nothing. We would have actually forced China to posture and maybe to be less cooperative.
So, who does pay for the World Health Organization? North America correspondent James Glenday takes a look.
America is the WHO's biggest single funder. According to the organisation's figures for last year, the US provided just under 15% of its total budget. The next biggest contributor is the Bill and Melinda Gates Foundation, followed by the UK and Germany, while Australia chips in almost $30 million. Just under 70% of the money is spent in Africa and the Middle East. More than a quarter goes to eradicating polio, 2% on HIV and hepatitis. Preparedness for pandemics accounts for just 0.8%.
We're still receiving plenty of your questions here at the ABC, and we put some of them to the La Trobe University epidemiologist, Associate Professor Hassan Vali, and the ABC's national medical reporter, Sophie Scott. This question is from Rebecca. Can my family travel and congregate in the same house or office to address a family death or probate or legal issues around her father's estate? Police haven't been able to offer any guarantees about how lawful that would be, so she asks, where can I go for advice? Sophie?
Well, look, I think the answer is that it would probably depend on the state and territory. Some state and territories are being very, very cautious and actually pulling people over in the car to say, where are you going? And, why are you out travelling? It would be safer for all involved if they could do it as a virtual conference and just get onto a video streaming service and do it as like a FaceTime or a Zoom or some other way like that. That way, that's going to minimise the risk.
JL, who's reached us on Facebook, asks, what is the actual research, scientific, not economic, guiding the decisions on going back to school? Janine Healy-Meldrum points to a number of coronavirus infections in children and teenagers, and it makes her wonder about how safe it is to go to school and whether children are spreaders. Dr. Valley.
It's really interesting because the evidence probably comes from three sources. There's evidence that we've obtained from previous influenza pandemics and epidemics. There's evidence from SARS and MERS and modelling that's been done around that. And then, of course, there's evidence from what has actually happened, over the last 3 or 4 months around the world. And the really interesting thing is, when you look at the evidence, the actual evidence, now there's obviously a little bit of contention there and it's a bit messy, but a lot of it pretty much says that there is only a marginal benefit that you get from closing schools, but that comes at a massive cost. So it comes at a massive economic cost, a massive social disruption cost, maybe a cost to the health system with essential workers not being able to go into work. And of course, there's the educational cost. So you can see why this is such a difficult policy parameter for governments to deal with.
Dr. Valley, is it risky for our immune systems in the long term, for our bodies, not to be attacked by the various random viruses and germs we would normally be exposed to in day-to-day life. Now that we're using loads of hand sanitizer and washing our hands well and not touching our faces, does this make our bodies get a bit lazy when it comes to fighting off disease?
Yeah, look, an interesting question. I think we've got to separate out the fact that we're in a particularly unique situation right now that's not going to be the case forever. And so we have to adopt a whole range of measures that may not be the case, hopefully, past the end of the year. Hopefully, before too long, we'll start to ease some of these restrictions and we'll start to revert back to doing things the way we normally do. So I think we've got to make sure we keep that separate from what we might do long term. And the evidence is really interesting about the effect of having sort of day-to-day infections on priming the immune system. And, this is where this whole field of healthy bacteria has taken off in the last few years. So, yeah, I think, the shorter answer is that we've got to be careful that we don't go overboard and that we recognise that there are good bacteria as well as bad pathogens.
Dr. Hassan Valley there. And if you want to hear more answers, you can check out our full 40-minute chat on the ABC News YouTube and Facebook channels. We'll be streaming live those question and answer sessions every Friday at 3:15 Eastern Time. So keep those questions coming in. We'll be back with you next week. Bye for now.